Marxism is the psychosis that keeps on giving. So here we have, from Elizabeth Warren, yes, Chief Spewing Bowl herself, introduces the Anti-Racism in Public Health Act. It's time we start treating structural racism like we would treat any other public health problem. That makes literally zero sense. In fact, it makes so little sense, we might actually have to start considering making Marxism a public health problem because it is a psychosis. It absolutely warps the mind and turns people's brains into mashed potatoes. It creates a complete inability to discern fact from fiction, truth from lies. It is absolute pure insanity. And if you need any proof of that, just go to Twitter and look at the videos of people who are burning the cities down. And they're burning them down in Democrat cities in order to protest a Republican president. It's not about this has nothing to do with police brutality. This has everything to do with the fact that we have a president that is actually standing up against the ideas, and that we have a fervor, a pro-American fervor growing in this country, and they absolutely hate that. The communism here, it's been a slow creep for the last 60 to 70 years. And with Donald Trump, they realized that it was going to deflate that balloon that has just been slowly inflating in our culture and in our society over the last really almost 100 years. I mean, but really in earnest over the past 60 to 70 years. And it is driving them absolutely insane, realizing that Donald Trump is the pen that is about to pop that balloon. And that is why they have gone so far insane coming up to this election cycle. Because they know that 4 more years of Trump, when he is not restrained by needing re-election, he is actually going to be able to implement all of the things, indictments as well, that need to go down in order to weed this out of our culture. You saw in his platform he was going to teach, or that they were going to implement American exceptionalism into our education program, as opposed to this critical race and gender theory that has been entirely overtaken our education system. So, we have here, in line with several states that made similar declarations, Senator Elizabeth Warren and other Democrats introduced legislation on Thursday that would make racism a public health crisis. How is racism a public health crisis? Can you go to the hospital and get an antibiotic for racism? Can you go and go in there and have a surgery, get it excised? No, you can't. It is an absolute conflation of different. It is an absolute conflation of two completely disparate ideas: racism and health. They're not one and the same. They do not mesh. They do not go together. But that is what they do. They take the whole everything is everything. This goes back to the whole idea that the personal is political, that they have been pushing for really since the 60s. That's when they really started pushing the idea that the personal is political. And what that essentially means is that everything in your life is political. And so this is their way of politicizing health, politicizing your health, not beyond just public health policy in terms of, insurance and things like that. But they are going to wrap this under the umbrella, racism, under the umbrella of public health, so that they can implement policies that essentially are going to create crime thought. It's or thought crime. It's gonna be thought crime. It's the Orwellian future here. The Orwellian future is here. So, according to Fox News, Warren joined forces with Rep. Ayanna Pressley. Of course, I'm starting to think that Ayanna Pressley might be the most radical of all of the squad. She's kind of the least heralded, but she might actually be the most radical. And Barbara Lee. Barbara Lee is still around, or maybe I'm thinking Barbara Boxer. I don't know much about Barbara Lee. To promote the Anti-Racism and Public Health Act, which would therefore put COVID restrictions in the same square as Black Lives Matter protests. While we're at it, why don't we put Bigfoot and the Chupacabra on top of the FBI's most wanted list? Because that is about what this is. Racism, the fact that racism is a huge deal in America is a myth that is perpetrated by critical race theory and then blasted out through a megahorn or megaphone by our media, by Hollywood, by all of the pillars of cultural influence that the left has infected and infested. It's time we start treating structural racism like we would treat any other public health problem or disease, investing in research into its symptoms and causes and finding ways to mitigate its effects. That still doesn't explain how you conflate health and racism. They're not one and the same. But they want to scramble everything into a pot so nothing is discernible. Nothing can be separated. Nothing can be told this is this and this is this. Because the personal is the political and everything is everything. It's a scramble. Just like it scrambles the brains of people who adhere to this ideology. Again, like I said, if anything, you can make communism a public health policy because it does scramble the brains of people who adhere to its core tenets. I mean, you can show a far leftist the clip of Donald Trump condemning the white supremacists in Charlottesville right after, in that whole clip of the very fine people on both sides, and they will still not believe it. That is psychosis. That is a derangement. That is a mental that is a mental health problem right there. Trump derangement syndrome is real. And it's quantifiable, it's verifiable. You can show it. When somebody cannot accept truth when it is laid right in front of them, that is a mental health problem. Racism, not a health problem. And especially not one that needs to be treated. They're going to talk about taking it to the CDC, studying it, and how it affects life. They're not one and the same. It's hard to even come up with ways to... This stuff is so nonsensical and so ludicrous, it's almost hard to put into words how it isn't, because it's so obvious. It's like trying to talk about the theory of how a square has four sides. It's like it just has four sides. Just look at it. It's that obvious and it's that simple. Yet they try to absolutely obliterate such simple truths. That's what makes it so difficult to argue against this stuff, is because it's so obviously false. But you can tell them it's false. You can show them it's false. You can prove them it's false. They still won't see it. How do you continue that argument? It's really, really frustrating, and it's really scary. So it's time we start treating structural racism like we would treat any other public health problem or disease, investing in research into its symptoms and causes and finding ways to mitigate its effects. Again, how do you do that? How do you quantify racism? How do you put it in a laboratory? First of all, we have not had racial issues in America this all started under Barack Obama, who pushed forward all of this critical race theory stuff, who never did anything, to talk against everything that was going on with Michael Brown and Ferguson. He fanned the flames of it. He stoked it. But we never had all of these race issues under, say, George W. Bush. And again, this is not a defense of George W. Bush. I was not a fan of George W. Bush. But back then, critical race theory did not rule the mindset of America. And we didn't have the same racial stripes. We didn't have the same racial divisions. And I grew up in the South. I grew up in a very, there were people from, I grew up in an area, I think the county that I grew up in, I believe, I can't verify this. This was just secondhand told to me, that for a while there, it was the most socioeconomic diverse county in the entire country. So I grew up around people of all stripes, all colors, all classes, all religions. And we didn't see these problems. They didn't exist. Everybody got along. And this is in the South, that is supposedly the most racist place in the world. Or, I guess, yeah, if they say we're the most racist country in the world, which is patently false. But they say the South is the most racist region in this country. I grew up in the South. I grew up with all different kinds of people. Never saw it. All I saw was everybody hanging out, getting along, and not really caring. Because we got beyond this. And that is the big problem. We got beyond racism, and all of a sudden, racism, which became such a massive, it's hard to even say it was a cottage industry. It became a mansion industry. It became a mansion industry. And it became a massive political tool. And once that started to disappear, the last thing they want is for racism to end. Which it was. Racism was kind of a thing of the past. It was dead and buried. Or at least it was on life support. And that was a problem for those who want to use it for political expedience, to drive us apart and conquer us. So our bill with Representatives Lee and Presley is a first step to creating anti-racist federal health policy that studies and addresses the disparities in health outcomes at their roots. You know, I never heard the term anti-racist until about a month ago. You know, an anti-racist, the people who promulgate these ideas, the leaders of the anti-racist movements, are overt racists. Robin DiAngelo, the author of White Fragility, is an avowed racist. She basically opens every speech with, "I'm a racist." Okay, bitch, well then why should we be taking cues from you? You know, she talks about how she clutches her purse when she sees black people. We don't all do that. That means you suck, Robin DiAngelo. Go look in a mirror and stop projecting all of your own animosity towards other people onto us. And then you got Ibram X. Kendi, who wrote How to Be an Anti-Racist, talking about discrimination is good if it doesn't create inequity, or if it creates equity. And he said discrimination is bad if it creates inequity, but it's good if it creates equity. So if we're going to instill this anti-racism into our health system, imagine you go for a surgery and they say, "No, we can't admit you, you're white. We're waiting for a black person who needs help first because we haven't met a quota yet." Because that's where this is going to go. There is no stopping the train of progressivism. You know, it's funny how everything that we talked about racism that was once satire is now true. Because you cannot satire progressivism without progressivism catching up to the satire. Because things that sound insane to us end up becoming what their norm is, end up becoming where their ideology goes. We're just projecting it ahead of the curve. You know, we exaggerate it. And then that exaggeration ends up becoming reality because progressivism doesn't know where to stop. My bill, so Ayanna Pressley, a member of the Squad, and increasingly becoming the most radical. She's almost making AOC look like Margaret Thatcher at this point. Ayanna Pressley, a member of the Squad, said that the federal government has failed to address structural racism for long enough. Okay, well tell us what you mean by structural racism. They speak in all these vagaries that pluck at the heartstrings of easily manipulative people, easily manipulated people. But they don't ever have to define their terms. What they'll do is they'll take the language that already has a connotation to it, that already has a cultural understanding to it, and then they'll shift the Overton window of that term so that it means something entirely different, but still has the emotional response of its old meaning. They do that with hate. You know? And I know I talked about this recently in another video. I mean, sometimes I feel like I'm a broken record talking about this stuff. But they keep pumping it out, and I have to keep making the arguments against it. You know, when I grew up, hate was a strong term. Now it just means you disagree with something that I can project onto a disparate group, a minority group. You know, you try to argue, you know, if you have a position that you believe in traditional marriage, and it's not because of any opinion you hold with gay people, but it's because you actually understand the foundation of the family unit being a building block for society, and how having a marriage is supposed to be about having children. It's supposed to be about the promulgation of life, and two homosexual people can't cause that, so it just doesn't fit into that platform. But they can't hear that kind of nuanced argument. They can't hear that kind of nuanced thought. To them, it just means you hate gay people. No. That's like saying if I want to go join the WNBA and they won't let me, it's because they hate men. No, it's the WNBA. It's an institution and an organization that has a certain set of requirements. But they don't hear that. Of course, they try to do the reverse. And you can be a man and join the WNBA if you chop your dick off first, but you're still a man. Your chromosomes are still the same. For far too long, our federal government has failed to recognize and address the structural racism that has devastated black and brown communities and denied access to quality health care. They make these assumptions that if black and brown communities don't have as good a health care, that it has to be racism. It can't be the fact that, or the possibility that maybe they're lower income, and maybe they're lower income because you have whole communities that have no father figures, and so these kids grow up with no direction in their lives. I actually don't entirely disagree with the idea that there is systemic racism. But if you actually look at the real things, at the real places where systemic racism happened, like in welfare, and how they systematically bribed the father figures out of the houses after the Great Society was passed, and how the person who passed the Great Society passed it saying, this will get voting Democrat for 200 years. So I'm not even going to completely say that there is no systemic racism. But if you start looking for the actual root of systemic racism, they're talking about how they're going to get to the root of it. But they're not. They're going to get to everything that has nothing to do with it. It's so impossible to argue these people because they have no sense of reason anymore. They have no sense of logic. We actually saw them recently trying to argue that 2 + 2 can equal 5. Literally, the example out of Orwell, out of 1984. 1984 at this point has become a manual for them. It's become a playbook, not a warning sign. So let's see. So with COVID-19, the Black and Brown communities access denied healthcare, Presley said. With the COVID-19 pandemic unveiling and exacerbating racial disparities in health outcomes, it is time we recognize and treat structural racism and police brutality as the public health crisis that they are. That right there, this is very revealing right here. Health outcomes. Outcomes. That is what they believe in. They do not believe in equality of opportunity. They do not believe in fairness and being treated equally. They believe in outcomes being equal. And in order for outcomes to be equal, the only way you can do that is to pull down the top, down to the common denominator, down to the baseline. They don't want anybody to succeed. They don't want anybody to rise above the rest. But they have absolutely zero ability to look at the effects that has on society from broader, more further reaching areas. So like innovation. They have no idea how dragging everybody down to the baseline, everybody down to the common denominator with no upward mobility, how that will absolutely halt and stagnate innovation. And how the ability for people to rise up has created innovation where right now people who are homeless can get better health care than John D. Rockefeller. They don't look at these things. And it's not that they don't look at them. It's that they don't care about them. Because racism is not the end game. The end game is dragging everybody down to a baseline so that you can subjugate them. It's about getting rid of any sort of middle class. It's about getting rid of any upper class that they don't belong that they don't belong to. There's going to be an upper and lower class, but it's going to be the ruling elites and then everybody else that is just dirt poor. And there's going to be no upward mobility. There's going to be no hope. Upward mobility means that people always have hope for a better future. But these people will tell you that there is no hope because of the color of your skin. And yet they want to tell people like me who want you to have hope, to want you to reach for the stars, that I'm the racist and that they're the ones looking out for you. When they want to grab you by the ankles and weigh you down from ever climbing up. They want black people in a state of despair, because then they're able to manipulate them and use them. And they're absolutely terrified that black people are starting to wake up to this and that they're running in droves to Donald Trump and realizing that they have been pawns of this agenda for so long. I mean, you look all the way back into the 70s and the Black Panther movement. That was all Maoist. You look back at the writings and the speech of Manning Johnson, who was an avowed communist in the 1930s for over a decade, rose through the ranks and then realized who the real racists were, and then volunteered himself to speak at the House Un-American Activities Committee, talking about how the blacks were nothing but pawns to the Marxists, and how the Marxists treated them like second-class citizens, even when they were high-ranking Marxists themselves. They were still second-class. They want these different classes because they know that they can always pick apart those classes. And they don't want people to ever have the ability to rise above those classes. Because if you have that and you have the hope that you're able to do that, then they have no boogeyman. Though Black Lives, let's see. So, okay, the legislation seeks a national center for anti-racism at the Center for Disease Control to research and explore racism's health impacts. It could also create law enforcement violence prevention program. Yeah, so that's another. Oh yeah, I think I skipped a little bit. Yeah, so it's time we recognize structural racism and police brutality as the public health crisis that they are. Okay, so we have about 350 million police interactions every single year. And last year, that resulted in the death of 9 unarmed black people. Out of 350 million police encounters in the year, 9 unarmed black people were killed. Now, 19 unarmed white people were killed, which completely undermines, especially when you factor in crime rates by race, that completely undermines the idea that our law enforcement is racist. But they won't hear that because, again, they cannot listen to rationale. They cannot listen to reason. They cannot sort out facts from fiction because it's an ideology. And an ideology, it's a cult. It's a cult-like ideology. And anything that goes against it has to be manipulated, has to be a ploy, has to be some sort of evil plot against their ideology. Their ideology is an evil plot against America. It is an evil plot against the principles of liberty, against self-preservation, or not self-preservation, self-determination, self-governance. And, they could turn around and say that we're ideological too, but we're not ideological. Freedom and liberty is not an ideology. It may be a philosophy, but it is rooted in critical thought. And it is funny how they call all of these, they call it critical theory. And sure, it might be, but there's no critical thought in their critical theory. It is just a theory that is critical of whatever system they want to tear down. That's why they call it deconstructionism. That's why postmodernism is all rooted in deconstructionism. Now, deconstructionism is a con. It's even in the word. Deconstruction. What is different about deconstruction than just flat out destruction? They are conning you with the word, but when you hear construction instead of just destruction in it, it makes you still think that it is building something, that there is still a sense of order to it. That it still has to do with building something positive. Even if it's taking something down, it still has the idea that that you can reassemble it if it's deconstructed, that the parts remain intact. But that's not what they're out to do. They're not out to deconstruct America. They are out to destruct it. They are synonyms. Let's see. It would also create... so the legislation seeks to create a national center for anti-racism and the Centers for Disease Control and to research and explore racism's health impacts. It would also create a law enforcement violence prevention program. I think when you have I think last year it was what, 41 total unarmed people killed by the police, and in a total of 350 million police encounters. I wish I had my calculator app open. I'd pull that up right now and see what percentage that is. It's microscopic. It's not a crisis. Things happen, but they don't care at all about black on black crime in these neighborhoods, which kills vastly more people. I mean, by orders of magnitudes of magnitudes. But they don't care about that because that's not their narrative. That doesn't actually promote their end game. Their end game isn't racism. Never was, never will be, never has been. Though Black Lives Matter protests were an undeniable source of the bill's inspiration, of course, because it's reactionary, because all this is doing is following the culture. It's the what's the term I'm looking for? It's the tail wagging the dog. That's exactly what it is. Another was the fact that black Americans were disproportionately affected by the COVID-19 pandemic. Dr. Anthony Fauci stated in the early days of the pandemic, first of all, it also has to do with black Americans were disproportionately affected. What are you going to do? Put a virus on trial for being racist? So, as Dr. Anthony Fauci stated in the early days of the pandemic, black Americans had a high level of comorbidities that led to higher death rates. We've had a particularly difficult problem of an exacerbation in health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately affecting minority populations, particularly African Americans. First of all, these three right here, diabetes, and actually, really, asthma might even be linked into this too, but not quite as closely. Diabetes, hypertension, and obesity. They all essentially come down to the third one here, obesity. These are all problems that are brought on by life choices. By diet. And I mean, black people love soul food. I love soul food. Hell, there's a reason black people love soul food. It's fucking incredible. But black food is typically, that's the soul food. And it's not good for the heart. It is delicious, but it's not good for the heart. So if they eat that all the time, then yeah, they're going to have issues with diabetes, hypertension, and obesity. And obesity, I don't know if it can lead to asthma. It can certainly lead to respiratory problems. But these are not because of racism. These are because of issues with their cultural diet, for one, and also life choices by each individual. There's nothing about racism involved here. Unfortunately, when you look at predisposing conditions that lead to bad outcome with coronavirus, the things that people get into ICUs require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. Again, it might be prevalent in the African American population, but if you were to say, well, let's look at the African American culture, all of a sudden that is the same racism that is causing this. Even though what's really causing it could likely be cultural diets, which are choices. They're not forced upon anybody. They're not hoisted upon anybody. But then I would be the racist for pointing out that, well, maybe there are cultural issues going on here. But again, it never looks inward. And that's why, it's funny because I actually saw a tweet from Ayanna Pressley the other day where she posted a picture of herself and how she was bald, and it said something like, "Who needs hair when you have these cheekbones?" And it was basically just her talking about how beautiful she is. There's no humility. And I kind of forget where I was going with that, to be honest. Oh yeah, that's where there's no humility. Everything is outward facing. Nothing looks inward. And it's always somebody else's fault. It's never the responsibility of the left. Just look at Nancy Pelosi. She breaks the same coronavirus laws that rules that she has been espousing. And instead of taking responsibility for it, she blames it on the salon, claiming it was a setup. Again, always projecting, never looking inward, never taking responsibility, and never holding yourself to account. That is the leftist mode of operation, modus operandi. Always accuse your opponent of doing what you're doing. Saul Alinsky, right there. Again, I feel like a broken record because I feel like I'm repeating a lot of the things that I've said on many other videos. But again, if they're going to repeat the same things, well, then I have to as well for people to understand it. So today I signed an executive order declaring racism a public health crisis in Michigan. Okay, blah, 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 blah. So, this is all much of the same. But yeah, what's so funny is that all of this is now coming from Elizabeth Warren, chief spewing ball, who literally pretended to be Native American to advance her career, even though she is whiter than the driven snow. These people have no sense of self-reflection. They have no sense of self-awareness. And the fact that the left is not insulted by this means that they have no ability to think critically for themselves anymore. So how about we respond in kind and call Marxism a public health issue? At the very least, a mental health issue. Because it is. It rots the mind from within. And the person becomes nothing more than a husk of their former self. Anyways, guys, that's the video. Please hit the like button. Subscribe to the channel if you haven't already. Share this video. Also, follow me on Facebook, Twitter, Instagram, and Parler at Ram Thorburn. And also, if you are interested in contributing to the channel, there are links to my Subscribe Star, Patreon, and PayPal down in the description below. Thank you guys for watching. I hope you have a wonderful night.